Good. All right, other side. Nice. And again. Good. Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and I'm here with Zoe today. Zoe's coming in with a little bit of pain kind of in the lower back tailbone area. So why don't you just tell us a little bit about how it started and how long it's been going on?
Yeah, so it's probably started earlier this week. I noticed some pain in my lower back, and now over the last few days it's definitely gone into my tailbone, and I definitely feel it when I walk after sitting up or after sitting down for a while, and I get back up. I can definitely feel it like walking and moving around more. So
does it like change after you start walking a bit, or does it just kind of linger around for a while?
I think it lingers. It definitely has lingered, like definitely the past 2 days it probably has gotten worse. So,
okay.
Yeah.
And then like, is it initially when you're getting out of that chair that it's like the worst, or not so much?
It's really not the worst till I walk, I would say.
Just walking?
Yeah.
Okay.
Yeah.
Well, we're going to go ahead and take you through the SFMA, the top tier of the SFMA screen, and just check your range of motion, and then we'll feel the joints and see what we need to do from there, okay?
Yeah.
All right. So I'm going to just have you face here, and then we're going to just, with your neck first, look left and right as far as you can. Good. And to the right. Any restriction going left at all? Do you feel tension at all?
Not really.
Not too bad?
Yeah.
All right, now I'm going to have you face this wall, and we're going to look up and down with your head and neck as high up and as far down as you can. Try to touch your chin to your chest if you can. Any tension there?
Maybe a little.
Okay, and then look up at the ceiling. Yeah, that a little easier, smoother for you. Okay, now I'm going to have you look down at your toes and try to touch your toes. Okay, Zoe? How about there?
Maybe a little bit, yeah.
Where do you feel that?
In my lower back.
Come back up. Okay, and now reach above your head with both hands and look up and arch back.
I definitely can feel that one.
So come back up, and I'm going to have you do that one more time, and I'm going to show everybody what I'm seeing here. So when she arches back, I want to see a uniform curve throughout the whole spine. She's really curving more right here. There's not as much happening in the mid-back or the thoracic spine. So this is a very common thing we'll see with our patients, especially if they're coming in with lower back pain. We're loading the bottom two vertebrae or the last few vertebrae of the lumbar spine excessively, and then the mid-back's not picking up its end of the bargain to do the rest. So we'll work on getting your mid-back moving a little bit better. That's one thing sticking out so far. Now we're going to do a squat test. So I'm going to have you keep your feet together and give yourself enough room and keep facing this way. Okay. And hold your arms out in front of you, and I want you to squat down as low as you can while keeping your feet flat, okay? Okay. And come back up. And then do that one more time. Feel any limitations there?
It definitely gets harder as I get lower, obviously, but I mean.
How so? How does it get harder? What do you feel like you're restricted or pain? Or what?
Just restricted, I would say. Not pain necessarily.
And
but
where did you feel that?
Probably my lower back and maybe.
Point right to that spot.
Right here.
Okay, and is it more central or is it one-sided?
Central.
Central? Yep. Okay. We're going to just do a couple more tests and then we'll get started. Okay, I'm going to have you face that wall. Okay. And we're going to keep the feet together. Okay. And what I want you to do is you're going to look over your right shoulder and try to twist your shoulders and hips backwards like you're looking back at us. And come back to center. And then go to the left and rotate. That side's a little harder, huh? Where do you feel limited there?
Right in this area, I would say.
Right in that area?
Yeah.
Okay. Good, and then we're going to just check your shoulder mobility while you're that way. So I want you to take your right hand, reach behind your head, touch the top of the left shoulder. Yep, very good. And then relax and do the left side, touching the top of the right shoulder. Good. And then you're going to reach underneath and touch the bottom of the opposite shoulder one at a time. Good, and the other way. Good. Okay. Zoe, I'm going to have you sit on the end of the table here, and I'm going to sit behind you, actually, and we're going to start by palpating, and what that is basically I'm going to go and I'm going to challenge the joints starting in your pelvis and tailbone area, and we're going to work our way all the way up the spine, and we're going to figure out where they're not moving, and that's going to give us a good idea of where we need to adjust today. So I'm going to just start right here on the SI joints, and tell me if you have any tenderness with this.
Okay.
I'm going to bring you over to the side. And we're going to rotate this way. And then I'm going to move down just a notch. Same thing. Go over this side. Is that a little tender?
A little bit.
How about there?
Yeah, right there was, yep.
Okay. Then I'll be right on the left side. Over. Rotate. Not as much there.
No, not as bad.
Over. How about there?
Yeah, that is this most tender spot.
So the lower part of her SI joint, I'm noticing a little bit more restriction on her. Now I'm going to check the sacrum, and I'm going to bring you backwards first. Any pain there?
It is a little tender there, yeah.
Okay, now we're going to go forward, and I'm going to drop down on the sacrum a little bit. How about there?
Not as much.
More so here?
Mm-hmm, yep, right there.
So where L5 sits on the sacrum, definitely seeing some restriction there. So now I'm going to work my way up your lower back, and we're going to challenge joints that way. Right in there. L4, L5, L4, L3 are not happy. Okay, and we'll work our way up. So she moves pretty well through her thoracolumbar junction, but when I get up into the rest of the thoracic spine, the mid-thoracic, I can start feeling some resistance. Do you feel that when I push into there?
Yep.
So I can feel that a little better. I'm gonna have you put your hands behind your head, and then bring your elbows together, and you can just relax kind of your hands right here, and then let your elbows rest on my forearm, and we're gonna go forward, and then I'm just gonna challenge a little here. So that's just confirming even more she's lacking extension through this section of the thoracic spine, and rotation's not great through there either, and we need that thoracic spine to extend and rotate in order to keep everything else happy. And Zoe, you're at work, you're up and moving around a decent amount, but you do put quite a bit of time in on the computer and things of that nature, so you can find yourself doing a little bit of rounding.
Right.
And then you also do a little bit of photography too, so editing and things like that. You're on a computer or a phone a decent amount.
Yes.
So that's very common in today's world. We're on technology in the modern world, so we see a lot of rounding, and in Zoe's case, I think that's maybe trickling down a little bit into her lower back. Her lower back might be trying to overcompensate for that lack of mobility in the thoracic spine. So we found some restrictions in both areas. I'm going to recheck or double check the neck and make sure that's okay, because she did have a little rotation restriction when I was doing her initial screen. So we'll make sure we clear all that out. She does have a little bit right through here. Do you feel that? Like tender?
Yeah, it is tender.
And there's just not a lot of spring in that upper cervical. So we'll go through and do our adjustments, and then we'll recheck the initial screen that we did, and go from there, okay? All right, we'll start with you on your side. I'm gonna have you face me, Zoe.
Okay.
And what we'll do is we're gonna bring this knee up, and we're gonna kind of rotate your hands like this and slide forward, just like that, okay? Perfect. Comfortable?
Yep.
All right, so you just relax, and on 3, I'm gonna roll you towards me. 1, 2, 3. Good. All right, other side. Nice. We'll do this way. Just like that. There we go. Good. Nice. Good. On your back. And we'll get that thoracic spine. That went really easy, actually.
Yep.
And then lay flat. And then we'll cross your elbows over each other, okay? Just like so. Deep breath. And out. And again. Good. One more. Back up. And then lay on your back.
Okay.
And we'll take care of the neck. And then I'll recheck pelvis. All right. Ready?
Yep.
Right through there. Good. All right, flip onto your stomach, Zoe.
Okay.
Check the rest of it and rescan. here. A little bit left that lower SI, so I'm going to go ahead and do a couple drops. You're just going to feel the table pop up, okay? There we go. All right. One more. Good. All right, so come on up.
Okay.
I'll have you sit on the end, and then we're gonna just repalpate and watch you move and see how this back's doing. Good. So check lower. How's that compared to before?
Way better.
Good.
Less tender.
We're gonna do that extended motion at the sacral base. How's that?
Still a little tender, but better.
A little tender, but better.
Right there.
Right there.
Yep.
And then we'll work up. I'm gonna have you cross your arms. I'm gonna do a
Like
little bit
this?
of, yep, and
Okay.
just kind of hug yourself here.
Okay.
And we're gonna just work these paraspinal muscles along the lumbar spine. This is just shortening and lengthening the muscle, and we're creating a little bit of tension here. Does that feel kind of like a good hurt?
Yep. Yep.
Sometimes these muscles, if the joint's not really moving well, those muscles around there will get extra tight, and kind of gotta go in and lengthen those out a little bit to finish the job and keep the arms crossed.
Okay.
Yeah, go here. Very good. And then we'll go straight to the side and to the other side. A couple more. Good. All right, now I'm going to just recheck. That help a little bit. Then let's go hands behind your head.
Okay.
Elbows together. Lean forward all the way up. So as you can see in here, there's way more bounce. Does that feel different than
Yeah, it
before?
does. Way less restricted.
Yeah, so that's moving a lot freer in that thoracic spine. Now I'll recheck the neck, and then we'll watch you move, and you're going to be ready to rock and roll this weekend. Definitely a lot springier than it was before.
Right.
So go ahead and stand up,
Okay.
and I'll have you face here. And we'll just start by facing the camera, and
Okay.
then I'm going to have you just turn left and right with your head and neck. Good. Yeah, a lot smoother with the neck rotation. Go ahead and face that wall, and then we'll look up and down high as you can, and down as far as you can. A little easier, less tension looking down.
Yeah.
Good. And then we'll look down, try to touch your toes. How's that feel in the
Much
lower
better.
back?
Yeah.
Okay.
Much better.
And then reach above your head, arch backwards. How about there?
Still some tension, but way better than it was, for
Yeah.
sure. Yeah.
And then do your squat.
Okay.
Good. How about there?
Yeah, that feels way easier.
Less limited.
Yeah, way less limited.
And then we'll face that way
Okay.
and just do your twist behind each shoulder. Go ahead and twist as far as you can. A little bit left there that we got to work on. Keep going. Good. All right. Cool. So typically what we do is follow up with Zoe here in a couple days. We'll make sure we check this out at work next week. But as you can see, range of motion's better in the joints already. She's feeling a little less discomfort. So yeah, if you want to learn more about what we do here at our office, please check us out on our website or on any of our social media. And thanks for watching. Have a great day.